Hi everyone, my name is Michaela Duncan, and the career path that I've chosen to talk about today is going to be consultant dietitian. So, what exactly is a consultant dietitian? Basically, they work under contract with healthcare facilities or in their own private practice, and they perform nutrition assessments for their clients and advise them about diet-related concerns such as weight loss or cholesterol reduction. But there's a wide variety of what you can do as a consultant dietitian, which I'll talk about in the next few slides. So before you can become a consultant dietitian, it's important to know the education requirements. So you have to complete an Accreditation Council for Education in Nutrition and Dietetics certified bachelor's degree program in nutrition or nutrition science. So you must have an undergraduate degree to be eligible to sit for the registered dietitian exam. And then after you graduate from undergrad, you have to go and undertake an ASCEND approved dietetic internship program after you graduate. So the dietetic internships are going to be, it can be paid, but it's usually going to be unpaid, and it involves at least 1,200 hours of supervised practice working with a registered dietitian and will typically last around a year. So the stage that we're all in right now. And then you have to take and pass the registration exam for dietitians after you have the required supervised practice experience. And so after you take and pass the exam, you have to register or apply for a license to practice as a dietitian in your state as required. So most states will require dietitians to be licensed. And then it's not a requirement yet, but in 2020, as we all know, you're also going to have to get your master's degree in order to sit for the registered dietitian exam. So years of experience needed to become a consultant dietitian. It's recommended you work as a dietitian for at least 2 or 3 years to gain experience and develop your professional network. While it is possible to become a consulting dietitian as soon as you become registered, you need to gain significant experience in at least one area of dietetics to be more successful. And then it's also important to know that additional business licenses and tax filings might be required depending on what exactly you decide to do when becoming a consulting dietitian. And then just wait until you're ready and you feel comfortable being able to provide people with multiple disease states with nutrition-related advice. Okay, so salary. The national average salary for a consultant dietitian in the United States is $57,266 annually. And then according to an article on US News, so this is just the average salary of a dietitian in general, it's $59,410. And then, so the best paid 25% dietitians in 2017 made $72,490, and the lowest paid 25% of dietitians in 2017 made $47,720. So the consultant is right in the middle of both of those ranges. So employment opportunities. So what can you do with this? There's a ton that you can do, as I previously mentioned. Some consultant dietitians will work for wellness programs. You can work for sports teams, supermarkets, pretty much any company that wants to pay you for nutrition-related advice. It's going to be considered a consultant dietitian. You can be consulting with food service managers, providing expertise in sanitations, menu development, budgeting, planning. So there's a lot that you can do with this type of job. So the main reason that this interests me is there's a wide variety, as I previously stated, of things you can do, and this leaves little room to get bored. So I also personally am more interested in making detailed and specific meal plans for those who actually seek out my help versus in a hospital setting where you kind of just go, you calculate the patient's calorie and protein needs, and then you spend 10 minutes with the patient and that's it. I'm more interested in being able to see a client once, making a plan for them, and then being able to see them a few weeks or a few months down the road to see the progress that they've made and see how I've helped them. And those are my references. Thank you for listening.